everyone, welcome to today's event. I'm so sorry that we have some technical errors. Um, Welcome to today's event. It's gonna concern working in the NHS. My name is Olga Gozamani, and I'm currently the education leader of the preclinical education team, and I will be hosting today's lecture. Today we will tell you everything you need to know for how to pursue a career as a doctor in the NHS, what to expect as a doctor in your foundation year, and all the interview process. Well, we're going to go through it together with you. It's my pleasure to introduce you to our speaker, Dr. Hafsa Mahmood, who is actually a graduate from Charles University, first faculty in Prague in 2022. Dr. Hafsa was a foundation doctor, then she did her fellowship in gynecology oncology, and is currently a locum doctor in various departments in the NHS. And without further ado, I will hand it over to Dr. Hafsa Mahmood to share with us all her knowledge on the topic.
Hi everyone. So my name's Hafsa. I graduated in 2022, just like Olga said, from Charles University First Faculty of Medicine. And I'm just going to go through an overview of the process of applying to the UK, then what to expect in the interview process, and then what to expect as a first-year doctor. So I'm trying to keep it as brief as possible, but if you'd like me to explain a bit more, please don't hesitate to ask any questions. And I can explain that bit more if not understood as well. Also, like in the future, if you'd like any more lectures explaining a specific topic in more detail, we can also do that. So I'm going to start by telling you a bit about myself. So 3 years ago, I was a final year student. In the first faculty of medicine, there's a thing about pediatric exams being the block that you have to get over to get your medical degree. So I was most anxious about this exam. I was just like wondering like, oh, wow, how did I get to the 6th year? It was a lot of hard work, but also some luck. I'm sure everyone knows it depends on the professor you get as well. And I made a lot of really good friends while being there, and I'm still in contact with them. So that was amazing. At the same time, I was looking forward to moving on to start actually working as a doctor. And I wanted to finally practice medicine physically rather than just read it in books. So I did start researching about this a little bit before 6th year, but majority of it was at the start of it. There were a few lectures just like this one by ex-students who were now doctors, and they were doing lectures like this for us. So from graduation till now, I graduated. So the pediatric exam was okay. Got past it. Obstetrics and gynae was my last exam. In June 2022, that's when I graduated as a doctor. I got my GMC registration in July. And then I started immediately as a trust grade F1. I think I only had a month really of holidays afterwards. Then after that, I continued on to F2 in the same hospital and then did a clinical fellowship in gynecological oncology. That was a separate post that I applied to. And now, like I've finished that post in November. Now I'm working as a bank doctor because I just want a little bit of a more easier year before I go into training as a specialty doctor and as a GP. So this year, one of the things that I really remember well and I feel like I achieved was one of our presentations. There was an audit we were doing in robotic gynecology surgery while I was working there, which was presented at an international conference in Madrid. So that was really nice. And I saw a lot of really amazing doctors, consultants, and leaders of the robotic surgery team in gynae. I've applied for GP training now, which will start in August next year. So what I'm going to go through today are roles that we can apply to as international graduates, how to apply for them, and the interview process if selected, then life as an F1. So there are two different ways that I know of, which are standalone F2 and trust grade posts. Standalone F2 posts, you apply through an online channel called Oriel. Applications open in January of the year. So after 6th year, in the January after that would be when you would apply for this. IELTS is another requirement for everyone who's applying to UK, whether it's this route or a trust grade route, just to demonstrate that we can speak English. Even I had to do it, even though I was schooled in the UK. So it's a requirement just because the clinical aspect of our degree tends to be more in Czech rather than English. So like taking histories and clinical examination, that tends to be more in Czech. So that's why we need to do IELTS. The dates for IELTS tends to range from December to February, also in the 6th year. You can do it 1 year earlier as well because it lasts, I believe, 2 years. So with the standalone post, you're required to do an additional exam called the situational judgment test. So the way it works is you start with the application, you submit it, then afterwards they will invite you for SJT to book it with them. This would be around March. After that, after sitting the situational judgment test and its outcomes being released based on that score, you will be invited for an interview around April time. And then they start offering you positions from mid-May till the end of June. Then you start work in August after a brief induction period. It depends on the hospital. So some places they'll give you 2 weeks, some places 1 week, sometimes a bit longer. It completely depends. I just wanted to show you the recruitment timeline that I found, which is quite helpful. So this is more in detail. So from what I've read, I don't think we need to do the PLAB. I know definitely, like when I graduated, all I needed to do was the IELTS. But yeah, basically I've been reading about it, and on the GMC website it says that EU graduates don't need to currently sit either the PLAB or UK MLA, but it could change. So it's just keeping an eye on that and just making sure that it doesn't change in the upcoming time, like a few months before you apply. So this was quite helpful. This is more detailed. So I've given a rough guideline on the timings, but this is more detailed. It also has when to start applying for GMC registration on here. So in May would be when you should start applying for that. There's an online portfolio called Epic, which you start with, and they just ask you for validation of who you are. So passports, ID documents, things like that. And usually it's about a 2-month process getting the GMC license, but it depends on what documents were sent, whether you have all of them or not in time. So yeah, this is a nice guideline. So we'll go back to the slideshow. Trust grade post. So this is the route that I took to get into a hospital called Arrow Park Hospital. It's part of the Wirral University NHS Trust. So the way you apply is through track jobs. You just keep an eye on vacancies available and apply through there. They have their own application form. which is quite, it's extensive a little bit. And there are some paragraphs that you might have to write as well as a personal statement. I'll go into it in more detail a bit later. Another way you can apply is NHS jobs. Sorry, NHS jobs is the one that I use more, but track jobs is linked. So they tend to have the same jobs on there. You can send your CVs directly to hospitals. I know a couple of IMGs who did that. They may not have gotten the job straight away, but a few months later, when they had a vacancy open, they interviewed them and they ended up getting the job. So that's another way. BMJ Careers has jobs other than those in the NHS. So like private hospitals as well are on there. So there are specific hospitals that I know who employ international graduates more often than other hospitals. So there's Wiston Hospital, which is near Liverpool, Wirral University NHS Trust. So this is the one that I got into. Royal Surrey, Great Western Hospital in Swindon. This hospital also offers internships in between 5th and 6th year, I believe it was. I did this internship as well, and it was very helpful because they cover also the emergency department where you can see a whole variety of cases. Then there's Plymouth University Hospital. This one, I believe this professor still takes the CVs because I think I've seen like him still doing some lectures as well. So Plymouth University Hospital is another one. How to apply. So sending your CV versus track. So this is the one where you send CVs personally to different hospitals and just ask if there's vacancies, please consider yourselves. In your CV, it would be helpful to have a personal statement, just saying a bit about yourself and what you aspire to do. Make it more relevant to the job that you're applying for. Education, qualifications, clinical experience that you may have. For the UK, it is important to have a clinical attachment in the UK itself because they will ask you for evidence of that. They want you to have exposure to the NHS before you get in. Then there's teaching as well. That's a very helpful skill to have and to put on your CV. Anything about research or audit. So for me, I didn't do formal audits while I was in uni, but I was part of the mental health team, I was part of the mental health team and I took part in hiring a new counsellor at the time. So I wrote that down in my application and that counts as a change that you might have made. So there are formal audits, but there's also things that you might have done in uni as part of a society where you implemented change, and that will do very well on your application because it's a big thing in the UK if you do audits or like quality improvement projects. Leadership and management. So any experience you might have had in uni, you can just write that in your CV. Presentations that you might have given, awards, any certificates you got, any extra courses. So you can use also your elective courses in this. Interests, any hobbies that you might have, you can put that on your CV, and then you need some references as well. On track, it's quite similar, but on the track form, there's a section for supporting information, which is quite extensive, where you need to write paragraphs about yourself. So it's a bit longer than a personal statement. They do read this, and certain words will flag up the system, and you'll be more likely to be selected based on what you say. So in the supporting information, you can say something about teamwork, for example, like I worked in a team, and giving examples of that, like what you learned from it. In personal statements, in supporting information, you have to make sure that you do evidence each sentence. So after each sentence, you say, give an example of how you achieve that sentence. So every sentence has to be like informative with an example. So on the track form, they will also ask you for a declaration of practical experience. This would be certain things you've done as in uni, like measuring vital signs, catheterization, venipuncture, things like this. So I think you tend to have a white book that has a list of all the practical procedures that you've done. So make sure you keep that safe with you, and that will be your proof of practical experience. They didn't really ask me for the proof later on, to be honest, but it depends on each trust that hires you. Some may ask. So this is a rough guideline on the timing when applying via track. So in January, you would need to do the IELTS. So between December and February, like earliest dates are in December and latest dates are in Feb. So you need to check. They offer IELTS in loads of different countries and the timings are different. So it might be worth looking it up. I think the dates are up already because I was looking at them prior to the presentation and they were there. So you can see what would suit you if you are in sixth year and wanting to apply to the UK. Then February to March is when the application starts. So February was when I saw the job offer for Arrow Park Hospital. Then March to May will be when they do interviews. And then some places will give you an offer within 2 weeks. Some of them will take longer. It depends. Some will put you on a waiting list. And then you'll get it if another person before you on the waiting list declines their offer. So it could take up until June for you to know if you have a position or not. Then you will start your work in July to August. So induction period in July, and then August will be the actual work. So does anyone have questions at this stage? Let's see if I can... the comment section. Okay, so I'll continue. So the interview is split up into two sections. First of all, there would be about 2 examiners. One will be either the lead of the educational department or the lead of the hospital who is in charge of hiring. And then there will be another consultant who could be from any specialty. It's worth researching about the consultants who will be interviewing you beforehand, just to get a bit of a background of what they might be into. And then you'll get the response in approximately 2 weeks, but sometimes it could be longer depending on whether you're on the waiting list or just the hospital itself and how organized they are. So to prepare for the interview, I found these 2 books extremely helpful. Guide to CT, ST, and registrar interview. So it sounds like it's above our grade, but it's not. Like when you read through it, it's very helpful. It gives you some structures that you can use to answer questions that they give. And then for clinical scenarios, the Oxford Handbook of Clinical Medicine is amazing. It has a section at the end called emergencies. So those are like acute scenarios like asthma attacks or COPD or epilepsy, seizures or meningitis, strokes, heart attacks. Like it has a bunch of acute scenarios that you can read through. I still use it to keep my knowledge up to date now. but of course, like depending on the edition you have, you should compare it to guidelines as well. So NICE guidelines are the best ones to use, which is widely used in the UK as well. So the F1 interviews, so there's like, it's split into two different sections. Basically, one is just information about yourself and just certain things about teaching experience, asking questions about audit, difficult colleagues, confidentiality, consent, things like that. And then there's like a clinical scenario part as well. So, like I said, the book that I said earlier, this has a lot of information on how to answer these questions. It also says everything that you need to know about clinical governance as well, like what it is. There's 7 pillars, and also about difficult colleagues, how to answer questions like this. It tells you about confidentiality, consent, capacity. So I personally was asked about capacity, how to obtain capacity, what are the different ways. And I got difficult colleagues as well. So yeah, this is always going to be there. Background and motivation questions. Tell me about your CV or tell me about yourself. So for background and motivation questions, the book has this structure called CAMP, where you can talk a bit about clinical things. So what you've learned clinically, what you hope to achieve clinically, academic background. So like I'm into teaching, that's something I aspire to do. I've done it already. Management as well, how I manage certain issues, how I managed a group of people to get a certain outcome, and personal reasons like I like the area, that's why I applied, things like that. Then there's a star structure for questions asking for examples. So if they say, give me an example when, let's say, you saw a colleague and that would be this one. Examples of when you did teamwork, for example. So you can give like the situation. I was in the basketball team, and then there was a time when I don't know, we had to score, so I had to pass the ball to someone, and the way that teams work, we ended up scoring. So I've learned to do certain things. So it's a bit wishy-washy, but like it has this structure, so it helps you answer these questions when you get it. And then they have a SPIES structure. So one thing that when I was practicing interviews with a senior, they told me about patient safety being a very important thing to say. Like it's one of those words that gets flagged up in interviews. So if you say, patient safety is a priority, so I would make sure they're safe first in difficult colleague questions, then they will love that. Then you have the clinical scenario questions. All they're essentially looking for is A, B, C, D, E. And then if you look at like specific treatments in the book that I mentioned earlier, you'll have more of a guide on what exactly to do when you find certain things. And then life as an F1. So in my first year, it took me a long time to get over imposter syndrome, because when you go from being a medical student to actually seeing patients and actually being responsible for them, prescribing things, it's quite a big change, because now you have so much responsibility for that patient. But as an F1 in the NHS, whatever department you work for, there will be loads of help around you. The nurses are very experienced. They've seen those presentations multiple times. They can help you, and the system tends to be different. Like every trust uses a different system. There are a few that are similar, but within a trust, like all the hospitals, they use the same system, but different trusts can use different ones. So getting used to that, there is help. nurses, there's pharmacists as well. So if there's any medication errors, or they will flag it up to you, and you can change that. They will advise you on certain medication, like if a patient just came into hospital, the medication is not prescribed, they will tell you about that. So there's plenty of help. There are different specialties you can call as well if you need certain advice. So like if you're worried that someone might be having an MI and you have an ECG but you're not quite sure, you can call the cardiology registrars and be like, could you please have a look and help me out here. So there's plenty of help. So what's expected of you, usually as an F1, you do all the jobs of the day. So you have ward rounds every morning. They're consultant or registrar led. So you always have the senior with you in the mornings who come and see patients with you. And then you tend to do like the documentation and writing the plan, and then doing the plan itself as well. Like the plans can involve ordering tests, like blood tests, for example, x-rays, ECGs, ECGs tend to be done by nurses in the NHS. So you could ask a nurse, like, could you please do this, an ECG on this patient? Referring to specialties, there are usually bleeps. Some computers use online systems to refer, prescribing medication, discharge letters, that tends to be the F1's responsibility. You end up learning a lot of clinical skills. So I remember I was really nervous about this because when I was in uni, I didn't really get a chance to practice these skills. Venopuncture, cannulation, ABGs, catheterization, they were all things that I was nervous about doing. And the first ward I was assigned to was a general medicine ward, which had a lot of elderly patients. So it was quite difficult. But you pick it up quite quickly. And some hospitals also offer clinical skill sessions. I think every hospital does have a department where you can self-register yourself to practice clinical skills outside of work as well to improve on it. So again, there's always help available around you. But yeah, you learn quickly, and I know like a lot of international graduates who picked these skills up in the first few months. So yeah, don't worry too much about it. First, you'll have your first clinical point of contact with patients. You'll be the first point, actually, and with relatives as well. So sometimes a patient might tell you, oh, I have this issue, like there's a rash on my skin, I'm not sure, it's itchy, and then you will need to do something about it. Usually here you just find out what might have caused it first, and then there's like chlorphenamine. As long as they're not going through a massive anaphylactic shock, you can give like antihistamines. And if it's worse than that, if it's progressing, or if you think that they're getting worse, you can speak to a senior, like an SHO should be around, senior house officer or a registrar. Then there's you're the first point of contact with relatives as well. So sometimes like during visiting hours, relatives will come to you and be like, can you give me an update on so-and-so? And you'll be in charge of doing that. You always have the notes available on your computer system, so you can always read through everything that's happened since they've been in hospital and what to convey to them. It's important to prioritize jobs. So like if someone needs imaging or blood tests, do that before doing discharge letters, for example. Then, like I said, there's a lot of support. SHOs, registrars, consultants, nurses. ANPs are advanced nurse practitioners. So in the UK, there are a lot of nurses which are basically like registrars. Like they have a lot of knowledge. They're amazing with communicating to patients because they were once a nurse. They're like really helpful, especially for junior doctors. They're very helpful. Pharmacists, occupational physiotherapists, they tend to be in charge of discharge. Then you have your EAT portfolio, which you need to build on for specialization. And there are weekly teaching sessions where you can improve your knowledge as well. So there's something called handover as part of being a junior doctor, because NHS care is 24/7, 365 days of the year. So there might be some things which weren't done during the day because it was just too tight. Like some bloods were taken a bit later on in the day that you might need to review. You might need to review scans. Again, there's always help available. There might be patients becoming a little bit unwell out of hours, and you might be the first one to see them. The only thing you need to know is whether you're able to help them yourselves or whether it's something you need to escalate to somebody who's more senior than you. So there are different types of duties you can have, which are non-standard. So a standard day would be the one on the ward where you complete jobs during the day, 9 to 5 or 8 to 4. And then there are on-calls, like where you work in the evenings, nights, you hold a bleep and you get called to do odd jobs during the day and out of hours as well, like prescribing things. Like a patient might say, oh, my patient is having a little bit of back pain that they used to have even before hospital. Can we prescribe some paracetamol? And that would be safe to give. So met calls as well. That's a thing where there's a medical emergency team who come when you put the call out because a patient is deteriorating. Then you can receive and give jobs during handover as well. There are other jobs like clerking jobs. So if you're in the acute medical unit, then you can take the history of a patient, come up with a diagnosis. Post-take ward rounds is when you go around with consultants and you, again, it's like writing a plan and then doing the plan. Then there's an e-portfolio, which is something you need to work on during your foundation year, where you have meetings with two different supervisors. One's a clinical supervisor so each rotation has a different clinical supervisor. And then there's an educational supervisor who looks after you the whole 2 years that you're there. And then you have to put in certain things. So build on your portfolio, like put reflections, case-based discussions, mini KEXs, DOPS, which are procedures that you might do, like catheterization. And then you also do audits and QIPs, which are quality improvement projects. Taking part in data collection and things would be part of audits. And you put that on your portfolio to build it so that it can be used when you want to specialize. So that's it. Are there any questions on any specific topics we went through today? How important is it to have an attachment in the UK prior to applying for a job? Is it mandatory? So considering how many people you're going against, I would say it is mandatory. It's extremely important because literally when you even go into the job description, they'll say that you need to have prior experience of some sort. So it's important. I don't think there will be many jobs, especially like if you're against so many other people who do have clinical attachments, they will be prioritized over you. So yeah, I would say it is. I think I was doing some research about where you can do it. There were basically Swindon, Great Western Hospital is where I did mine. Then there was yeah, there are a few other hospitals as well, like Imperial College. They do one, but that one's paid. Then there's Gloucestershire. I just saw an ad today. They seemed quite friendly for IMGs. They were inviting people to come over, so I think that would be a good one to apply to. They had an email. Yeah, if you just type in Gloucestershire IMGs, it will come up. So that would be helpful. How long an elective placement should be, doesn't matter if it's just 3 weeks. No, 3 weeks is fine. I think minimum 2 weeks. The longer the better, but as long as you have something like where you can say that I was exposed for 3 weeks, I know if you can demonstrate what you learnt from it, I think that's more important than the length of time. If you're able to like go to different departments in that 3 weeks as well, that would be the best thing to do. But it's just like making sure that you know how the NHS system works. So like certain ethical questions as well, like capacity assessments and what you would do in certain situations. So that's something that you should pick up and talk about. Can we do OET instead of, yeah, you can do, I think there was, yeah, there's OET and then there's IELTS, so you can do either or, whatever you prefer most. I personally did IELTS myself. How is trust grade F1 different from locum F1? Okay, so trust grade F1, so you tend to be in a specific department, so you get more support if you're a trust grade F1. So trust grade F1 means the hospital has hired you and they're responsible for you. So they will make sure that you have that support, you have like extra pay if you're working longer hours, or you get more annual leave if you're working longer hours. Locum F1 is a bit more individual, so you're responsible for yourself. Like it's a bit more difficult being locum if you haven't worked before in the NHS, I'd say, and you're less protected. So that's what's different about the two. Like I would suggest, like just to be safe, trust grade is better. However, saying that, like locum F1, if you're in F1 position, there will always be support regardless. So if you do ask, like if you're more careful as a locum F1, you speak to like SHOs, registrars, if you're unsure, whenever you can, then it's fine. And yeah, in F1, yeah, I was able to rotate specialties. So I did general medicine twice and then colorectal surgery. The only thing, like being an IMG, because they're taking on extra trust grade F1s, sometimes you get less choice than people who are there already. But then in your second year, you'll get better choices. Again, it depends on the trust as well, whether there are more IMGs compared to national graduates. So something that I did was I didn't complete my F2. I started applying for junior clinical fellow jobs. So you can apply, because we have full registration, we can apply to junior clinical fellow jobs as well. If it's a specific department, there will be support there as well. So again, that's when the trust is responsible for hiring you. So if you're not getting the rotation you require, then you can just apply for those jobs separately as a junior clinical fellow. But yeah, the most important thing is getting in and getting some experience. So yeah, I rotated in F1, and then as F2, I started ED, and then I did gynae oncology. What is the CREST form, and do you have to ask for one during the interview or after you start working? So the CREST form, so most trust grade places, so the place I was, Arrow Park Hospital, they already knew that they were going to expect a lot of people wanting crest forms signed. However, you have to have some certain requirements. So if on the crest form, it does talk about quality improvement projects and audits and how you've demonstrated those things. So if you fulfilled all those in your first year, you can get it signed. You just need a consultant to sign it for you. So if you build a good rapport with someone, you can do it. I got mine signed at the end of my junior clinical fellowship. So and during your interview, you can ask as well, like, would you be willing to sign my crest form at the end of the placement? And you can ask when that would be, or like, would they do it at the end of F1, or would you have to finish till F2 for them to do it? So most of the placements offered to IMGs are observerships. Is this also considered as elective? Yeah, so I'm aware that they only let you observe. I think it's the same with medical students, even from the UK. So it's the same. You don't get hands-on training. It is considered as elective, yeah. So you can do that. And that's what most people did. Like when I was in Great Western Hospital, I wasn't able to do it straight away. Do any clinical stuff, but they took me still, as long as I had a knowledge of how the NHS works. Thoughts on straight into F2 standalone. So F2 standalone, technically you're doing the same jobs as an F1 would be doing, but you're a bit more responsible. So like if there is an F1 there and you're an F2, they may ask you for questions about how to approach certain things. I think it's definitely doable. For me, I just needed the safety factor because I was already feeling like, oh, I'm an imposter. So I wanted to do F1 first to get a feel of it, like more than what I did in my internship, because I didn't feel it was enough. So I wanted to start with F1. But if you feel confident, if you've done like a few internships, then you can do F2. But I just wanted that safety net. So that's why I didn't do F2 standalone. I did F1. I know somebody who graduated from first faculty who's now doing F2 standalone. And basically it's a bit of a steep curve. So she struggled in the first month or two, but now she's getting better. There's always a reg around, so she's okay. Like, and it also depends on the team around you, but it's a little bit more of a responsibility and it's a bit more intense than F1 would be. Like as an F1, they don't expect you to know anything or make decisions. As an F2, they expect you to somewhat make some decisions. Are UK graduates prioritized when it comes to applying for different positions? And does having a UK passport help when applying as an IMG? So, being completely honest, some places do prioritize UK graduates. So Wirral prioritized UK graduates, but other places like Wiston and Great Western Hospital, they didn't care if you were a UK graduate or weren't. Like they took you regardless, depending on what your application was. They gave a fair chance. Plymouth also, they were fair. Like they were like, anyone is welcome. It doesn't matter about the UK. And I think it might be based because of whoever's at the top and the expenditure of sponsoring someone for a role. So it's a bit of a political one. So what else beyond clinical experience can help secure a position? So apart from that, so the things that I mentioned, so on your application, teamwork, evidence of that, leadership skills, research can bring you up as well. Making a change is a huge one. So a change could literally be like in your in the uni you just create a society because you felt like it was missing, and even if you do a couple of meetings and but have evidence of that, that would be a change, for example. Or I don't know, I think with me it was the mental health thing where I just realized we needed a counselor. So that was my thing. Also, if you get certificates or awards, that would help. If you present some work internationally, that would be quite cool. Just things like that, presentations, taking part in change, even audit. You could even start an audit where you're studying. You could just say, oh, people are using these resources. This is the outcome of the exam. They got this grade. Making it anonymous, of course, and collect data, and then just be like, this is the best resource to use. So it's that, something like that would help secure a position. Any more questions? Can we apply directly to the standard 2-year foundation instead of having to go through the trust grade route? This question, I'm not sure of, to be honest. I would have to do more research. I personally don't know anyone who did use that route, because most of them, I think, got in through the trust grade route, or standalone F2 positions, or they emailed places. So I don't know anyone who did that. I know there was a girl who was looking into it. I can ask her and get back to you if you like. But I don't know. No worries. Any more questions? Any topics that you think would need another lecture that you would like to know about a bit more? Okay, so I think that's the end. So if you could just fill in a feedback form for me, that would be very helpful.
I think we still have one more question, Doctor.
Oh, okay, sorry. I'm so sorry. Let me just go in here. Roughly how many trust grade roles did you apply for before landing a job? I applied for 4. So there was Wirral University Trust Hospital. I applied to Swindon. I applied to Royal Surrey as well, and Plymouth. So I got accepted to both Plymouth and Arrow Park Hospital. Yeah, so I picked Arrow Park because I think I had already got it before I got the Plymouth job, so I had accepted it already. So 4 of them. Any more questions? No worries at all. So I'm just going to put up the feedback form again.
Thank you, Dr. Hafsa Mahmood. It was a very informative presentation, and we truly appreciate you taking time to inform us on the topic. And
no worries at all.
We all hope that you find today's topic valuable. And as the doctor said, please take the time to fill the feedback form that you can see it also in the chat if you press feedback. Thank you all again, and we wish to see you in our next events.